Dyad Rounding, brought to you by the proud team at Dixie Regional Medical Center. In the summer of 2017, Intermountain Healthcare embarked on the journey of implementing Dyad Rounding, which is a team-based bedside rounding service involving providers, nurses, and most importantly, patients and their family, and via an evidence-based communication framework with the end-state goal of improving patient compliance, improving clinical outcomes, enhancing caregiver job satisfaction, as well as patient satisfaction. This is driven by the concerns our patients and their families were surfacing, specifically that our physicians and nurses were not always on the same page, the care seemed disjointed, and there were possible patient safety concerns. Our patients, as well as caregivers, deserve to receive and deliver extraordinary care, supported by the fundamentals of care being safety, quality, patient experience, access, and stewardship, and all underpinned by highly engaged caregivers. Our engaged caregivers have a core belief that patients deserve to live the healthiest lives possible, and this is accomplished through thoughtful, patient-centered, team-based care, and through the delivery of standardized extraordinary care. Patients and caregivers will experience best-in-world outcomes, communication, and decreased cost. It is anticipated that patients will enjoy the perception of team-managed and coordinated care, which is exactly what patients and their families prefer. That their concerns and medical issues will be identified earlier, preventing failure to rescue, and that the messaging to the patients and families will be much more streamlined and unified. Caregivers should expect to enjoy improved quality of care and delivery, have the opportunity to manage up colleagues and have themselves managed up by their colleagues, enjoy the benefits of a team-based model of care, and physicians and nurses will gain perspective on the wins and challenges that each are experiencing through the care day. Since its implementation, multiple patient safety stories have been brought to light, where patients have experienced, via the various error prevention techniques, prevention of harm, and earlier identification of problems. The example here demonstrates an early identification of an evolving infection, prevention of an inappropriate discharge, and earlier intervention and provision of optimized care using the error prevention techniques of Stop and Resolve and STAR, which are core on our journey towards zero harm. Units that have piloted Dyad Rounding have enjoyed excellent compliance with nurse-physician Dyad Rounding, here demonstrated to be in the mid-90% range. During implementation, ADET was demonstrated and implemented as a communication framework for caregivers to communicate with families and with each other in a way that would decrease patient anxiety, increase patient compliance, and improve clinical outcomes. At the very first opportunity for Dyad Rounding, it is encouraged that discharge be discussed, and that it be updated daily on the communication board and discussed at all subsequent Dyad rounds with the goal to optimize the plan and ensure the patient is prepared for a safe and timely discharge. Dyad Rounding will help on our journey towards zero harm, and physician and nurse satisfaction will be improved via improved coordination in care and teamwork. Data has already begun to show that patient increased satisfaction with nurse and physician communication, as well as their perception of coordinated care. It is anticipated that length of stay and readmissions will also demonstrate improvements. The standard work for physician breaks down into 5 steps, which are chart review, notification of the rounding RN, provider and nurse huddle prior to the Dyad Rounding to establish a shared mental model, Dyad Rounding with the patient, nurse, family, and physician, and then ultimately the physician entering orders into iCentra prior to moving to the next patient. The communication plan for physicians presenting to the floor is indicated here with the goal of ensuring the nurse is available and the Dyad Rounding can occur as demonstrated. These helpful tips have been learned through the initial implementation. These tips are as follows. It is encouraged to perform hand hygiene immediately prior to entry and upon exit from the room, that the physician commit to sit with the patient and family, with chairs being provided in each room, explaining things in the way that patients understand and recognizing their level of healthcare literacy, making eye contact, listening carefully to understand and not just respond, shaking hands, treating patients and the entire care team with courtesy, respect, and acknowledging all in the room, demonstrating genuine care and concern, and managing up yourself as well as your colleagues. Thank you for your time. So it was 3. Oh, hey Peggy, it's Dr. Rideout. How are you? Yep. I'll be up in about 5 minutes to round. Will you just put the word out and see if we're going to have nurses available so we can do Dyad Rounding? We have a few discharges we want to accomplish this morning, so again, I'll be up in about 5. Great. Yeah, I'll see you then. Thanks. Bye.
Good morning.
Well, hey Tia, how's it going?
Good, how are you?
I'm doing well. I was just reviewing Brenda's x-ray labs and seeing how she's doing overnight. You taking care of her today?
I am.
Okay. Looks like x-ray wise she's looking great. You know, those concerns we had in that right lower lobe, looks like that's nothing. That's resolved. Vital sign wise she looks like she's doing great. Is she eating better?
Yeah, she's doing good.
Okay, I was thinking about maybe switching her to oral antibiotics today and maybe even discharging tomorrow. Does that sound reasonable?
Mm-hmm. Yep.
Okay, good. What concerns do you have? Anything?
No medical concerns. Okay. She's just a little emotional today. Her son was supposed to come home this weekend from deployment, but due to some issues, he's not going to be able to make it home.
John, right?
Yeah.
Yeah, John's with the Nevada Guard. We deployed them about a year ago, and as I recall, got a message that we extended about a handful of them, about 6 months of it. He's on that unit that they extended, so I'll address that and be thoughtful how we do that. That's too bad, especially with him maybe coming home this weekend and we're going home. That would have been perfect, but yeah. Let's go chat with her.
Okay.
Brenda, hey, it's Dr. Rideout. How you doing this morning?
Good.
You ready for rounds?
Sure.
Okay. Good morning.
Good morning.
Nice to see you. So who's this?
I'm Charlie.
Hi,
I'm
Charlie.
her sister.
I'm Dr. Rideout. Nice to see you. So T and I had a chat here just a second ago and coming up with a plan of care for today. We're going to chat with you and see if we can move you towards maybe going home tomorrow. Does that sound like a plan? So grab my chair here. You know, T and I have worked together for, what did you say, T, about 10 years?
Yeah.
Okay, great. She provides extraordinary care, doesn't she?
Yeah.
She's a great team member. We're pleased to have her and lucky to have her. So tell me how your night went.
Not too bad. I slept a little bit better because I'm not coughing quite as much.
Okay,
So it's okay.
Great. Any concerns?
No, I don't think so. I just really would like to get this off back. It'd be nice.
Yeah, well, and on our communication board yesterday, we kind of went over what the goals might be over the next 24 hours. Talking about that chest x-ray, we did obtain that this morning and just reviewed it. It looks great. The concern we had, that right lower lobe on your right side, it's gone. So I think that was just probably the pneumonia, and it's rapidly getting better, and it just demonstrates how resilient and strong you are, and that the therapies and stuff are working. So the incentive spirometer you've been doing, getting up out of bed, and we're also seeing your oxygen requirement come way down. So we're thinking about maybe even taking that off today. So if you want to take it off right now, we can go ahead and do that. Yeah. And then the other concern you had about the IV, we chatted about that yesterday.
Mm-hmm.
I think we can switch off the IV and get you onto an oral antibiotic. Because pneumonia, even though you're feeling great now, we've treated you for 3 days, it usually takes about 7 to 10 really to adequately treat. So we're going to get you switched over to oral medicine, make sure you tolerate it, and then send you home with that prescription so we completely
So I
treat.
just do that at home.
Mhm.
That's good.
Do you have trouble swallowing pills?
Not normally.
Okay. But what we'll do is we'll get the first dose up here, and T will bring it in and go over how you take it and what we look for if there's going to be problems related to that. Make sure you're comfortable taking it and that you tolerate it well. So in anticipation of going home tomorrow, we'll be all set.
Oh, good.
Okay, great. Now, you know I'm part of the Nevada National Guard, and I understand John was supposed to come back this week. It sounds like he might have been on the unit that we've extended for 6 months. I'm sorry. I was really hoping to see him back.
I was really hoping he would come home, but they just told me yesterday he's not coming.
Yeah. Have you had a chance to Skype with him or anything lately to kind of know? I know he knows you're in the hospital, but that you might be getting ready to go home?
I haven't talked to him while I've been here.
Okay.
But I hope to do that when I get home. That would be really nice.
Well, actually, Brenda, let me go get my iPad. We'll just set it up here.
Oh, that would be great.
Yeah, that'd be
I know
good.
he's doing great things, but my mama Hardest really wants to see him.
Well, I'm really proud of the fact that you raised a son that's willing to do that type of sacrifice, and we need folks out there defending freedom, and so I applaud that effort, and he'll love knowing that mom's feeling better. So why don't we get him on the line and have Charlie set that up?
Yeah, that would be great. That would make me feel better.
So Tia, what on the communication board are we missing here?
Nothing, so we did the chest x-ray this morning and we just took off the oxygen, and then our goal for today is to transition over to the pill antibiotic, so I'll be bringing that in to you.
What about the Lortab? What about the pains? I know when you first came in a few days ago, you were really complaining about the pain and the
it was
cough.
hurting really bad every time I coughed, but I'm not coughing so much anymore.
Okay.
So.
Well, how about I propose we stop the Lortab so we can get rid of the opiates? I know you've had that concern about the side effects of the
Yeah, I don't
opiates.
like how it makes me feel.
And do you prefer Tylenol or the ibuprofen when you typically have pain when you're not here?
Ibuprofen usually works better for me.
Okay. Well, would you be okay with switching to an ibuprofen and we'll give that a try?
Yeah, let's give it a try.
Okay.
That would be good.
Now, in terms of going home tomorrow, what we'd like to do is have everything accomplished. So first thing in the morning, if you're ready, we can scoot you home and get you out of the hospital. What are the barriers going to be to making that happen? So usually transportation, we make the
My
meds and
husband
stuff.
works. Are you
I've
around?
got the day off. I keep telling you that, sis.
So, well, she sounds like she's got it under control.
Okay.
So she can take
She has a
it.
big
That would
sister.
be great.
Yeah, that's it. You'll owe her.
Well, probably.
Well, of course she
That's a
owes me.
given.
Okay. I don't anticipate needing to send you home on oxygen or have any medical equipment, so we don't have to accomplish that. We'll get her medication, the ibuprofen and the antibiotic. We'll switch you over to Augmentin. Any allergies
Not that
you can think of? Because I reviewed and we didn't have any reported. And I know in the past when I saw you in the office that we'd used the penicillin type medications that didn't have a problem.
not that I know.
Okay. Tia, what are we missing?
I think that's it.
Do I need to give Dave a call to give him an update on where we are, or are you comfortable calling
I
him?
can call him. That's fine.
Okay. What are we missing?
I don't think so. I can just go back to work when I feel okay, right?
Yeah. I think just pneumonia happens this time of year. I think viral process, and then you get a bacterial process on top of it, and some percent of the population ends up in here in the winter months, and even young, healthy folks like yourself. And not much you can do to prevent it besides vaccination. So we'll make sure, that's the other thing we could even look at is make sure we have your flu vaccination up to date. You're not old enough yet for the pneumonia vaccine, but that will be in your
I usually
future.
get a flu shot every year. but-
Okay, so we'll check and see if we have that available because we're almost in the window for doing that. So we'll get that squared away.
That would be good.
Okay. Well, am I missing anything? Since you're a sis, you probably know things that we don't know.
Just want to get her home so I can harass her some more.
Okay, great. Well, thanks for being here.
So I think we're good, but Brenda, Dr. Rideout has gone through a lot of information with us today, so we want to make sure that you understand what the plan of care is. So can you tell us what you understand the plan of care to be?
Yeah, we already did the chest x-ray and you said that was improved. And then you let me take my oxygen off, which was really nice. And then you're gonna bring back pill that I can try until we can maybe switch over to pill antibiotics instead of the IV stuff.
Perfect.
And then you said something about going home tomorrow.
Yes,
So
ma'am.
that would be great.
Okay, that's the plan.
So,
Okay.
so yeah, I think that's good.
Well, Brenda, thanks for letting us take care of you. I'll come chat with you this afternoon to see how your discussion went with John and if Dave has any questions. Charlie, it was great hearing from you, and make sure you get John on the phone.
You got it.
Thanks.
All right, thank you.
That's good.
Okay, so Tia just checked me on this. So I've got the oxygen discontinued, PIV discontinued, IV fluids, stopped the Rocephin and started the augmentin. Am I missing anything?
No, we were just gonna put her on ibuprofen and stop the Lortab.
Okay, so let me discontinue the Lortab there. And then 800 of ibuprofen, and we'll do that every 6 to 8 hours by now. And then we've got our diet squared away already. I'll put in the plan for discharge in the morning. Did we miss anything?
No, I think it looks perfect.
Okay, perfect. Well, I'll come by and see her this afternoon, and then you're going to be back tomorrow?
Yes.
Okay, well, let's see if we can get her squared away first thing in the morning and get her home.
Okay, thank you.
Thank you. We'll
Have a
go
good day.
round and dismiss next.
Okay.